Good afternoon. A warm welcome to this meeting of the Health and Wellbeing Board, which is being held virtually and broadcast live and recorded for publication. Please do bear with us if you experience any technical issues. If we lose any members from the call temporarily, then officers will seek to assist in getting them reconnected as soon as possible, hopefully without the need to halt proceedings. Officers will inform the meeting if they are unable to rectify the problem and if we need the meeting to be paused or adjourned temporarily. When participating in the video conference, please remember to mute your microphone when not speaking, avoid any personal data being shared on your screen, and to assist with sharing the meeting, please use the virtual hand icon, but if not, just raise your hand. If we need to vote on a particular issue, we'll ask anyone to show if they are against, followed by anyone who wishes to abstain. We'll then assume that the remainder signify their consent. Thank you all very much indeed. Agenda item 1 is to appoint me to the chair. At Nottingham County Council's full council meeting on Thursday, 15th October, I was appointed as chairman of the Health and Wellbeing Board. I would like to thank Councillor Tony Harper for his chairmanship of the board, and I look forward to working with you all with the ultimate aim of improving the health and wellbeing of the people of Nottinghamshire. Agenda item 2, the minutes of the last meeting held on the 7th of October 2020. Can the minutes be approved as an accurate record, please? Any matters arising? No. Are we all in favour on approving the minutes? Thank you. Apologies for absence, Martin.
Thank you, Chairman. So the apologies I've received for this meeting are from David Ainsworth and Lucy Dadge from Nottingham and Nottinghamshire Clinical Commissioning Group. And we have a change of membership. Councillor John London substitutes for Councillor Tony Harper for this meeting. Thank you, Chair.
Thank you, Martin. Agenda item 4, declaration of interest by members and officers. Do any members or officers present have any disposable or pecuniary interests or private interests, pecuniary or non-pecuniary, to declare? No. Thank you very much indeed. Agenda item 5, which is Chair's report. Have we got Jonathan Gribben on? Martin?
Yes, I'm here.
Are you it?
Yeah, standing by.
Thank you, Jonathan. Before I give my chair's report, I'm going to introduce the Director of Public Health, Jonathan Gribben, just to give us an update on. I know a lot of us up to speed with the COVID, but I've just asked Jonathan to give us an update, the latest update, to keep us all up to speed on the COVID. So thank you, Jonathan Gribben.
Thank you, Chair. Yeah, I'm happy to do that. And good afternoon, councillors and board members. It's nice to see many of you, at least on my screen, if not in the flesh. I'm going to take you through some numbers and a few slides which will be very familiar to some of you, less familiar to others. I will be framing the current situation partly in terms of how it's impacting our local NHS and our hospitals in particular. But Chair, if I may, with your agreement, at the end of that, I wonder if I might also ask Melanie Brooks just to comment in terms of how it might be impacting our care system more specifically, just to round out the description I'll give.
I think that'd be very useful. Thank you, Jonathan. Okay. Thank you, Melanie.
So I'm going to, if I manage to press the right buttons in the right order, I'm going to bring up on my screen in a moment or two a few slides to talk you through. And just at the moment, my machine is not playing ball. Here we go. I think I've got it now. Chair, could you nod if you've got a table on your screen now?
Yes.
Great. OK, thank you. So I'm going to talk you through then the data as it stands as of yesterday. In the table that you've got on your screens, we've got a different line in here for each of the districts and boroughs right across Nottingham City and Nottinghamshire County. And I'm going to draw your attention to 2 or 3 of the columns which are particularly pertinent to this. So I'm looking initially at the column which is 4th from the right hand side. and in that you will just about be able to make out that we've got listed there the incidence rate of, this is for new COVID cases, people of any age, and it's expressed here as a rate per 100,000 over the last week. And you can see there that Nottingham City continues to have the highest rate right across Nottinghamshire, but not far behind that we've got a number of our boroughs, particularly in the south, that are pretty close to it, including Gedling at 387, Rushcliffe at 346. But also, as we've seen over the last 2 or 3 weeks, other districts further north into Nottinghamshire pretty much catching up and matching those rates. So those rates are all very high. Of equal or perhaps more concern to me is the information in the column just a couple of to the right. So I'm now looking at the column second from the right hand side of the table, and over here we have rates now focusing in on over 60. So what this is telling us what's happening in terms of confirmed cases amongst older people. And you can see that most of those rates are slightly lower than the all age rates. Nevertheless, they're running at very high rates and across all of the county now in every district and borough. This breaches what a week or 2 weeks ago we were very focused on, which was the threshold for moving into tier 3, but which of course is now somewhat superseded as we're all moving into lockdown. I'll make one other comment about this particular column, and that is that whereas a week or 2 ago I would have been telling you that the rate amongst over 60s is increasing right across the county, what we see now are still some very sharp rises.
Unknown participant is now joining.
Unfortunately, I've got the echo back again.
All right. Sorry, everyone. That should be Councillor Tideswell just joining us on audio only.
Yeah.
Okay, you're in the meeting, Councillor Tideswell. Sorry, Jonathan, for interrupting.
Okay, I'll continue.
Thank you.
So the what you'll see there are some percentages which are telling us that in some districts and boroughs the rates continue to rise very sharply amongst older people, but that in at least a couple or 3 districts and boroughs they're leveled off, and in fact over the last week or so have decreased very slightly. And I'm going to come back to this in a moment or two. Before moving on from this chart, though, let me draw your attention to some numbers right in the middle in this red column here, and that is telling us for each district and borough the proportion of people who get tested and who are found to be positive. And the significance of these numbers is that they're also on the increase almost right across the board, not in Rushcliffe, and they're running in all cases at levels which are really very high if you would compare this across the East Midlands. And unfortunately, this is an indication that the virus is still in wide circulation in the community. And I think we still face very much the risk of the rates which I've just been referring to pushing higher potentially. I'm going to move on then just to a chart now which focuses us in on what's been happening over the last month or so amongst rates of older people in Nottinghamshire County. So along the horizontal axis at the bottom, we've got a series of dates running from the 6th of October right up to the end of October. On the vertical axis, I'm sorry, I've truncated it there, but it's telling us the incidence rate. The brown line is showing us the rate amongst over 60s. And this lumps all of the districts and boroughs together. So I need to be reminded to say that actually the picture is slightly different from one district to another, but broadly this is the picture we've seen over the last month, that rates rose very sharply for the first 2 or 3 weeks, but I'm pleased to say there are some signs over recent days that those have leveled off, and in some districts and boroughs have just declined very slightly. So that's a a potential signal for us, which is encouraging. But quite quickly, I need to flip back to a further word of warning. And to frame this, I'm going to talk just a little bit about how things are in our local NHS, which indeed many of you will have heard talked about on our local media. So compared to the COVID, to the wave 1 peak, what we see in terms of hospital deaths at the moment, those hospital deaths related to COVID-19, is that they're lower currently than in wave 1 peak back in the springtime, but they are increasing across all of our hospitals. If we look at the usage of intensive care and high dependency usage beds, again, we see that usage at the moment is lower than at the peak of wave 1, but that also is increasing. And in fact, the part of the reason that deaths are lower at the moment, and in particular that usage of ITU is lower, is because we've now got improved treatments, and there are fewer people who go into hospital with complications of coronavirus who then go on needing the most intense treatment. So that's a good thing. But of course, it also means that those people do need still to be in hospital and in another hospital bed, and that in turn is creating pressure on other beds. And in fact, if we're looking across Nottingham University Hospital and Sherwood Forest Hospital, bed occupancy for patients with COVID-19 was running at 40% higher than the peak of wave 1. And of course, all of these things are indications about how seriously we need to be taking the transmission rates within the community, because it's those rates which are driving some of these pressures. And finally, I'm going to talk for a moment or two about admissions. Now, NHS England at a regional and a national level tend to be rather cagey about allowing our NHS hospital colleagues down at a local level in sharing some of this data, but this is already in the public domain, and so I'm feeling comfortable to share it with you in this meeting. It doesn't represent anything that hasn't been shared already. It focuses in on Nottingham University Hospital, but in fact we see a similar picture developing also further north in the county. And as of last week, we were hearing reported that admissions in NUH running at about a ward full of people each day being admitted to NUH with COVID. And I think straight away when it was framed like that for me, and perhaps for you too, you'll be able to see what a pressure that creates. And in fact, on the very last day for which we had data, it was as many as 67 new patients being admitted to Nottingham University Hospital on that particular day with COVID-19. Now, the reason for framing it in this way is because if we think about that admission rate, that ward full of patients, the community infection rate, which was giving rise to that, you actually have to look back perhaps a couple of weeks or so earlier into October to find the infection rate that was giving rise to the admission rate that we saw at the end of last week. In other words, there's a built-in lag between a community infection rate that we see and then people ending up in hospital. And if we were to think about deaths in hospital, in fact, we'd probably need to look back another week or two further back beyond that to find the infection rate resulting in the most recent hospital deaths. Now, the reason for drawing your attention to this is that if we look at the admission rates at the end of October, they were really arising from transmission acquired back in the middle of October, around the time that Nottinghamshire was going into Tier 2. And if you look at what was happening amongst rates in over 60s, and that's the group of people from whom most admissions tend to arise, not all, but mostly, actually rates at that time were running at something like half of what they are today. And in fact, hospital deaths arising at the end of last week probably arose from when community transmission rates were about a quarter of what they are today. The reason for describing it to you in this way is that although it's a promising sign that we see these rates in over 60s flattening off, it's not until, well, firstly, I think we need to go into this with the expectation that if we look at what's happening in hospitals, I'm afraid the pressures will continue and in all likelihood will continue to grow over the next 2 or 3 weeks or thereabouts. So we're far from being through the woods. And if we want to bring those pressures back down to a much more manageable level, it won't be sufficient simply to level off, but we will actually need to think in terms of how we turn around the trajectory. So that's something that it's worth keeping in mind. I think, Chair, at that point, I think my update would be probably best rounded off with some comments which just describe this in terms of how it's affecting the rest of the care system. So with your permission, I'll hand to Melanie to do that.
Thank you very much, Jonathan. Yes.
Good afternoon, Health and Wellbeing Board. So just to give a picture on the impact on the whole system. So across social care, we are seeing increasing outbreaks happening in places of accommodation, and particularly care homes. So earlier in the spring, we had a small number of care home outbreaks of COVID, and they were mainly relating to new admissions. So somebody was newly admitted to the home and had created an outbreak. Then through the summer, we had a small number of outbreaks that related to 1 or 2 members of staff being testing positive who were asymptomatic. And then in the last 10 days, we're seeing probably 5 additional outbreaks a day of care homes, and are currently managing 45 outbreaks, live outbreaks at the moment. So this is a concern for me for a number of reasons. Clearly, the people that we are supporting accommodation-based services are people most vulnerable to adverse impacts, if not death, relating to COVID. So working age adults with disability, learning disability, mental health difficulties, and older adults who are frail and needing support. So it's quite a concerning picture. And out of those outbreaks, we had 6 large outbreaks. What we know that's different this time around is those outbreaks are being created by community transmission. So it's not linked to somebody having COVID and being admitted to a care home. It's because of the general transmission, either because of staff or visitors placing that at risk. So it's quite a concern. So this impacts, I guess, in a number of ways. Firstly is that we're not able to support hospitals with discharge in the way we normally would because of the care homes that are closed because of an outbreak and the capacity there. It also means that our general ability to support is impacted because any staff that test positive, and some of these care homes have had 50, 60 members of staff testing positive, then also isolate. So it creates a business continuity risk. We're seeing that degree of risk happening right across social care, particularly in home care providers where the capacity has been about 70 to 80% of normal capacity because of staff isolating who are testing positive. So I think it's just to really reiterate Jonathan's point about the impact that community transmission is having on health and care and some of that risk that it presents really to our most vulnerable residents. So that's really all I wanted to say in addition.
Thank you, Melanie. Thank you, Jonathan. Any questions for either of them, please? Jeremy Griffiths.
Thank you, Chair. I think it's important to say, from a Health and Wellbeing Board perspective, that we look at the total impact of the COVID pandemic on our community. I noted with interest on the Chair's report the interesting article about the Public Health England paper on the wider impacts of COVID on health, looking at the impact on mental health, usage of alcohol, gambling, impact on exercise, maternal outcomes and crime. Do we have, whilst the paper is a well-balanced paper and well-written, I was interested to know whether we have, or whether we are monitoring the impacts across the system in terms of the knock-on effects of the COVID pandemic on the things that we certainly see from a primary care perspective, on our patient population. But I just wondered whether we actually have data on that.
Thank you, Jeremy. Jonathan, can you come back to that?
I can provide at least a partial answer to that. So, Jeremy, yeah, I mean, thank you for the question, and you're quite right. There are a whole range of impacts that coronavirus has, not only on health but on wider issues as well. And certainly there's an impact not only in terms of lives and health and well-being, but on livelihoods and well-being in the very broadest sense. Some work was done by the integrated care system over the summer period to undertake a very rapid impact assessment, looking at some of that. I know that local NHS colleagues will have been doing work as well, focusing in more narrowly on, for example, what the impact on particular care pathways may have been. So, for example, around cancer, and I know that much work has been undertaken to make sure that Nottinghamshire, which I think, as I understand it, was probably in a better position than many other areas, did its utmost to recover from those impacts over the summer period as best it could, notwithstanding the fact that now it finds itself, along with the rest of the country, dealing with the second wave. So much of that activity now recovery activity, I think, being put on hold to an extent. I think further work to actually quantify the impact right now will be on hold, because for any of us within the local authority, and I imagine it would be the case for my NHS colleagues who are on the board and on this call, a lot of attention now is really around dealing with the COVID response again. So it's probably about as much as I can add, unless Melanie's got anything further to add from an ICS board perspective.
Yeah, we did start to commission work on the mental health aspects, because we know anecdotally that mental health is worsening. So we hear that, Jeremy, from primary care colleagues about the concerns, particularly around young people's mental health, is what I understand is a particular concern. In our approved mental health practitioner service, we've seen requests for crisis support go up by about 30% over a normal winter activity. So we know that people are really struggling with their mental health. But we did have to delay some of the work that we were doing in the local resilience forum to understand these mental health impacts, because we're back into dealing with the move to tier 2, 3, and then now national restrictions, unfortunately. But I think we're well aware of it, but it's about our capacity to do something to understand that, really. But certainly we've taken some steps in the public health grant in the local authority to invest in some mental health supports. We're looking at ways that we can divert resource and social work resource into those areas. But like I say, in terms of that data piece, I think Jonathan's right, we're quite limited in our capacity to give it that kind of attention currently. It feels a bit more like we're firefighting, I guess, is the position.
I think we are. Councillor Bosniak.
On mute. You know, I'm usually quite proud of myself that I never forget to switch the mute off. Anyway, one thing I was going to say is that the Health Scrutiny Committee at County Hall are looking at this, Jeremy, because we're concerned about the knock-on effect, the other illness other than COVID, and the impact that COVID's had on people getting access for operations, etc. Even access to GPs is difficult. So that's what I was going to say. And the other thing I was going to mention, Kevin, is that it was around track and trace, but I'll wait until we get to agenda item 6 to talk about that.
Okay, thank you, Councillor. Right. Thanks, Joyce. Any further questions? David, Councillor Walters.
Yeah, thank you, Chair. Going off at a slight tangent, I've had an inquiry about the availability of personal or private thermometers. At the last lockdown, they were as rare as rocking horse, you know what. Does anybody know? Is there a better source or another source that people can get hold of these things?
I don't know if anyone can find that out for you, David. Jonathan or Melanie, I don't know if that's something on your remit.
I've no information on that. Sorry.
No, we'll get back to you on that, Councillor Walters.
No, thank you.
Sorry, Jeremy Griffiths again, please.
So I just wanted to come back to you, Joyce, on the comment about access to general practice. There has been some activity data for general practice showing that actually there's a significant rise in the number of contacts with GPs. What's happened is that general practice has adopted a model across the system of all requests for consultations with doctors to be actually filtered by the GP in the first instance. So every patient requesting to speak or see a GP is actually talking to a doctor first, and then it's the doctor that decides whether that appointment will take place face-to-face or whether using other technologies. So, and ultimately the aim for that is to avoid the scenario whereby doctors' surgeries become crowded places where people are waiting and then just passing infection between each other. So it's an adaptive model, but it's enabled novel ways of accessing care to take place. But in terms of the actual number of contacts, certainly I know for the Rushcliffe area, the contacts are at least up 10% on the data from last year.
Thank you, Jeremy. Joyce, do you want to come back to that?
Joyce, on mute.
It's been a long day.
Come on, Joyce. Come on,
It's
Joyce.
only Wednesday. I agree with you, Jeremy, that once you get through to the GP, I actually quite like the idea of a telephone consultation. I think it's easier. And I understand all of that. I think the difficulty people are explaining to me is something more fundamental, like getting through on the telephone. So it's not a criticism of the GPs, it's just the basic act of getting through on a telephone. I don't know what the answer is, and I think it must be mixed across the county.
Thank you, Councillor. Thank you, Joyce. Thank you, Joyce. Councillor Fletcher, please. Oh, sorry, Amanda Fletcher, sorry.
Hello, thank you, Chair. Just wanted to potentially add in a little bit of extra information to Jeremy's question, in addition to Jonathan and Melanie's comments. So I'm Nottingshire's consultant in public health that was actually helping with the ICS develop their health inequality strategy.
Unknown participant is now exiting.
And there are a range of metrics and indicators in that we wanted to monitor over time. So the last conversations we had with ICS colleagues were that they're actually looking to put in a funding bid to actually secure some extra analytical support to do that metric monitoring over time. So potentially there is support coming as of yet, but hopefully that will be our mechanism to monitor those impacts going forward.
Thank you, Amanda. Susan Shaw, please.
Hello.
Councillor Shaw.
Good afternoon. It's just a comment to Jonathan. On your slides, you're just talking about Nottingham and Sherwood Hospital. Do you keep abreast of the Doncaster and Bassetlaw? I know that's South Yorkshire and Bassetlaw, but I'm just interested in how that is translated into for the lives of Bassetlaw residents. I mean, obviously I'm on the board for Doncaster and Bassetlaw, and they do bring out a lot of stats, but I was just interested how public health in Nottinghamshire links in with that, please.
Yeah, thank you for the question, Councillor Shaw, and it's kind of you to prompt me on that. So the data which I shared there, which happened to be really around Nottingham University hospitals, I shared because it was out there in the public domain already. So yes, those of us working within the system also have equivalent information about the situation in the north of the county. What I can say is that although in mid and north Notts the situation isn't quite as acute as what we see around Nottingham University hospitals, broadly it's following on. So it's broadly a similar picture, and that's so the concerns we have in regard to Nottingham University Hospital and what's happening in the south apply pretty much equally right across the county. So I'm hoping that addresses the question. I wonder, while I'm talking about the local NHS, I wonder if I might, Chair, just make one other point, which I think it's really important to underline, and in particular, for anyone who might happen to listen in to the meeting, and that's that the NHS have made really good arrangements to prepare for wave 2. And notwithstanding some of the what from time to time might be difficulties in getting through on the telephone here and there, they've got effective and safe arrangements in place for any of us to be diagnosed and treated and managed. And it's really important that the message goes out that the NHS is there for all of us. It remains open for business, and it's open for business in a way that is really effective and safe. And what we don't want to do at all, and I hope that my presentation won't have done this, is to present a situation regarding our local NHS which in any way would dissuade residents from coming forward. If they've got any kind of symptoms which need to get checked out, they should do that. And if they're uncertain about whether it warrants it, they should ring 111 and they'll get prompt attention and really reliable advice that they should follow. Thank you, Chair.
Thank you, Jonathan. Idris Griffith, please.
Just picking up on Councillor Shaw's question, from a Doncaster and Bassetlaw Hospitals perspective, some of the figures that are in the public domain are that there are over 200 patients across the sites that are COVID positive at the moment within those hospitals. From a Bassetlaw Hospital perspective, the number is obviously lower. It's one of the smaller sites within the trust. But so there's about 28 patients currently COVID positive in Bassetlaw, and nearly half of those are on oxygen. That's not necessarily on ITU. It could be on a general ward, but they are receiving either oxygen or ventilation or mechanical ventilation. So as Jonathan said, it is a very similar picture really to the rest of Nottinghamshire, both in terms of the sort of incidence and the impact on the hospitals. And I think a point that was also made, which I think is really important to bear in mind, is while the hospital is treating so many COVID positive patients, it's also dealing with a very busy A&E and urgent care service, which is very different from the first wave, where we saw a significant reduction of people during the lockdown going to A&E. It may be that we'll see a similar impact when we go into the new lockdown, and that will certainly help take more pressure off the hospitals. And the other, as Jonathan has mentioned, and it's come up in the conversation, is the hospitals are also trying to maintain as much elective care as possible, because that has been really difficult to get through sort of this year so far, and we're very keen not to reduce that if we can possibly avoid it. So there are three pressures currently on the NHS, and that adds up to a very challenging situation.
Thank you, Idris. Thank you. Dr. Bartholomew, please.
Thank you very much, Chair. Mine comment is with regards to some of the wider public accessing NHS, and it's regarding what the public's perception, which then influences the experience. So, like Jeremy pointed out, primary care and likewise to a large extent elective care in secondary care hospitals is done through virtually. So when you ask for an appointment, the perception is that you are going to get a face-to-face appointment, and when instead you do have a telephone consultation or a video consultation, the outcome may still be the same, but it's the traditional view of seeing a doctor face-to-face which affects the patient experience. I'm not saying it's an ideal replacement for there are areas where, particularly areas like mental health, and there are parts of the community which would have barriers in accessing through telephone and video consultations. There's a very good integrated care system has done a very good report through an insight group, which was presented yesterday. I think, Chair, it might be very if we ask ICS to provide a high-level summary of that report, it might be really useful for the Health and Wellbeing Board to be cited on how the services have been accessed and the public perception and experience. So it's just that we need to be mindful of when we say the patient experience, it's even clinicians, we've been used to doing face-to-face. Overnight, we've got to do telephone consultations, video consultations. One thing I've raised is that there is also a bigger, larger piece of skill update, and an educational piece for clinicians also need to be upskilled in how do you deliver a service effectively through telephone consultations and video consultations, which then meets the expectations of the public.
It's all very different. Thank you, Dr. Bartholomew. It's so different. Thank you very much indeed. Where are we now? Jeremy, did you want to come back?
Yeah, it was just quickly just to get some feedback about since the test and trace system has moved to the car park at the council house, in terms of how that's the effectiveness of that, and any observations on peak usage. And I just wondered whether Jonathan might have some information there.
Chair, some information which is probably a week or 10 days now out of date. One of the reasons for moving the site from its previous location was because that was getting flooded essentially. So certainly County Hall will be a lot more effective than Motorpoint Arena, because it will be more accessible. People won't have to wade through puddles to get there. The data that I last looked at indicated it was getting good usage, but as I say, that was 10 days ago. I haven't looked at it more recently than that.
Thank you very much indeed. Councillor Longden.
Thank you, Chair. Just wanted to make a comment for Jonathan and his team. It was a tremendous report. It's really brought that home to what we actually should be dealing with. Just shows how widespread it is, not something that we can just isolate ourselves from. I think they've done a wonderful task. But as a warning to all, you all remember we woke up this morning to first frosts. We've got a winter coming. So they're going to a lot of extra probably winter deaths. So we need to make sure what deaths are COVID and what deaths are normal winter deaths. I'm not being down, I'm being purely practical. That's what I am.
Thank you, Councillor Longden.
Need to be just a warning there, so keep warm and look after yourselves.
Thank you, Councillor Longden. Do you want to come back?
Sorry, Chair, that was me not putting my hand down. Apologies.
Oh, right. Thank you very much indeed. I think everyone that wanted to speak has spoken on that. I apologise for changing the agenda, but I thought this was quite an important issue to keep people updated on. Councillor Longden, you've shared your screen again.
Yes, something's happened.
Councillor Longden, can you do the same thing as you did before and press the symbol on the top right? Thank you, Councillor Longden. That's wonderful. So I've sort of waived my my chair's report. There is quite a lot in it, and you've all had it in the agenda. And I think I just mentioned the suicide prevention funding, etc. There is quite a lot in it, and that is a big issue at the moment. I've had an email recently from the Royal British Legion and the effect that it's having with suicides and mental health for serving soldiers as well as ex-military personnel. So it's a massive concern. In my report, we've got to consider any actions required from the Health and Being Board in relation to the issues raised in my report. So if anyone's got any issues raised in my report, we can look into those as well. Councillor Shaw.
Thank you. I was just really interested in the domestic abuse fund. It is only £50,000, so I will get in touch with Rebecca, because it says for further information, because I'm interested to know, because equally domestic abuse has been has risen such a lot over the COVID, and now we'll have a second wave, is whether we've got enough bed spaces and how we're going to work to develop that further. But I can send an email to Rebecca, and maybe it can come up at the next meeting, because that's equally very, very important. Thank you.
Thank you, Councillor Shaw. It certainly is very important. It's something that there was a massive surge in domestic abuse, and it was something that Ashfield District Council dealt with very well, and rehousing people was a massive concern. Whether we're going to get the same in the next lockdown, I don't know, but it's something we need to be aware of. Councillor Walters. David.
Yeah, thank you very much, Chair. May I ask a couple of questions about the NOTS NHS app, if that's still on the agenda? Well, I'm a little confused about the use of this because, first question, my local primary care medical centre has its own website which does exactly the same or almost the same. Will this be then taken down or superseded by your new NOTS NHS app? The second part to that is, how does this fit in with the NHS Patient Knows Best app? It's getting a little complicated for me. And finally, for a question from Councillor John Wilmot, for patients without internet access or smartphones, is there a telephonic path to the service, or will we just continue to call their own GP or medical centre? Those are the three on that.
Thank you, Councillor Walters. It is an issue. It is an issue because we are at an age now where everything is done on app. I don't know whether Jonathan or is able to answer that, or Dr. Bartholomew, have you? Or Fiona Kelly. I don't know if anyone's willing to answer that or has got the answer to those questions.
I'm happy to, Chair, because I am involved with the IT group in looking at some of the stuff which was raised by Councillor Walters. With regards to NHS app, it will complement what's in a practice website. So essentially, the purpose of the NHS app is to have a digital care record in i.e. your smartphone or your iPad, so that accessibility. The Patient Knows Bed is another platform which will sit on the NHS app. So it's a bit like, so you've got worldwide internet, and we use Safari to access it through. If you're a Mac user, you use Microsoft Edge or Explorer to access the internet. So Patient Knows Best is not another app. It's something which will sit on as another tool within the NHS app which you can use. So NHS app is the wider app, and I would probably equal NHS app to like the App Store which you get with smartphones. So it becomes a platform how you access services. So it's not a duplication. It is very much complementing what's in there, and it will. And through NHS app, a patient could then see not only their own parts of your summary care record, which is your clinical record, but can also see hospital appointments, both. So appointments, both secondary care and primary care. Sherwood Forest have been a pioneer in getting patients signed up to it, so patients are then able to see what the hospital appointments are as well.
Thank you, Dr. Bartholomew.
Yeah.
So it complements it rather than. Does that answer that question? We've got Luke Barrett to maybe step in on another question for you, Dr. Walters. So, Luke, would you like to come in on Dr. Walters, Councillor Walters' question?
Good afternoon, Health and Wellbeing Board. Thank you, Chairman. Councillor Walters, it was just to address your question about the apps. There are a lot of apps. There's the National COVID-19 NHS app, which enables anyone to register to receive alerts about the current alert level where they live, and that is where they can also check into an establishment at the point where they could check into establishment to log that they visited an establishment. So that is the NHS COVID-19 app, and that's received millions.
I'm very clear on that, thank you.
Yeah, and then separately, we've got a My Nots app, which is the county council's app, which I think you were alluding to. And we signpost people to the COVID-19 app using that. So there is a sort of complementary process where you can access one app from another. You can't access the NHS, the My Nots app from within the NHS COVID-19 app. But yeah, I can certainly feedback your comments in terms of when they're reviewing the My Nots app, because there is a communications plan that's been attached to that to try and increase usage of it. But it's really helpful to get that feedback from you, and I can feed that back to the team that are involved in developing that.
Luke, while you're there, Luke, can you respond to Councillor Walters? I mean, it is an issue for people that don't have the internet or don't have smartphones. Where are we going with that? How are we assisting?
Yeah, so obviously we use a whole range, which I'll touch on in a moment when I get to the relevant part of the agenda, but there are a variety of channels that we're using to reach people with various different communications, including email communications. We utilise the local media. We do have access to print as well. So there's a whole range of channels that we're utilising to try and reach people. In terms of, did you have a specific question, Councillor Walters, in relation to hard to reach groups or people with lack of access to the technology?
Yes. Yes, but not just for COVID purposes, also for general GP or medical centre usage. Yeah, if they're not on the internet, they don't. A lot of old folks. Yeah, look at me. I do know a little bit about it, but there's quite a few people who don't have internet access. And will the new NOTS NHS app? Will you be able to access this? Let's say over the phone, over the landline, or is it? Do they need to access it? Will it be a must do before you see your GP? These are the very, very clear things that need to be sorted out, I think.
I think it's really valuable feedback, and I think I would signpost the customer service centres and the community hub as an opportunity to try and capture some intelligence about the challenges people might be having in receiving information electronically or utilising technology to access the information we need to provide them. So I certainly think I can take that away and feed those comments back, because it sounds to me like as we enter this next phase, that being able to get the right information to the right people is going to be more important than ever.
Mm-hmm. I agree.
Yes. Thank you, Luke. Thank you, David. I think it's a valid point, and it needs to be resolved. Thank you very much indeed. We now can move on to agenda item 6, which brings in the communications, which brings you back, Luke.
Thank you, Chairman, and thank you again, Health and Wellbeing Board. This follows on from the last Health and Wellbeing Board, where I was just describing some of the points I've just raised about the channels of communications and some of our experiences of connecting with communities throughout the COVID-19 pandemic. And I said I'd bring back some examples and insights into what that's looked like and how it's played out certainly on our social media channels and our website. So I had a couple of documents I wanted to share, and I think, Chairman, you should have a copy of that, but I will share my screen for the benefit of the rest of the Health and Wellbeing Board, if you just give me one moment. So, Mr. Chairman, if you could just nod to acknowledge you can see the screen. You should just be looking at what looks like just a fairly standard Word document, but behind the fairly bland and standard Word document lies a lot of energy and hard work. So the points I was raising at the last Health and Wellbeing Board is I just presented a general overview, and I said I'd just showcase how that's played out in terms of statistics. So if you cast your mind back to the springtime when the COVID-19 pandemic brought the nation to a halt initially, we reached out to our communities using all of the channels we have available to us, not just social media, but also email communications, and we used outdoor advertising media as well. But just in terms of the impact that some of our communications had, I just wanted to share with you some of the content that we shared and some of the stories that really captured the imaginations of our audiences. So if you can recall back to when we stood up the Community Relief Hub, it was a huge part of the response from the council in terms of how we reached vulnerable communities. And we decided to showcase examples of how that was working on our social media to try and bring it to life. So this picture you're looking at here is just one of our operatives who works in the Customer Services Centre, who's reaching those communities and those vulnerable people. And it's that kind of story that generated the interest, and it is the human interest element of our response that captured people's imagination and generated conversations and interaction on social media. And we take a view in communications where we interact with our audiences. It's a different approach to when we're dealing with the media, where we're having to go through a certain process. On social media, we have an informal and rather a well-established audience of people who like our content and follow us every day. So every time we post anything, they will see it if they are liking our content in the first place. You may recall some of the efforts that our catering teams made during those really difficult parts of the lockdown back in the spring. And this is an example of some of that work taking place. And here's an example of some of our care workers who took some selfies and posted them, and they received enormous amounts of engagement. And we're looking back at what we did in the spring as we now enter this new phase, And we're now reviewing again, what do we need to do to bring some of those case studies to life? And our adult director, Melanie Brooks, and I have had a conversation, and we've been discussing how we can bring some of those stories back to life, particularly about care workers and the important and vital role that our care workers are playing as we enter the next phase of the COVID pandemic. So I just wanted to first of all share with you that. I'm going to share with you, if I may, another document that highlights the more recent activity. So if you look at the last 28 days, so the first part of the COVID-19 pandemic was the original lockdown, and then we entered a new phase where that was lifted, and then we go into the most recent 28 days where some of those restrictions started to come in. So just to give you an example of the impact of our social media content, these stats here that you might be able to see on your screen just illustrate the reach that some of those.
You can't see anything.
Bear with me. I'll just.
It's so dark, Luke.
Bear with me. I'll close it and open it up again. Right.
You know why you're doing that, Luke? You know, what's your Facebook page called? I missed that.
So it's not CC.
Oh, right, just that. Right, okay.
Yeah. So if you, I'll show you a screenshot of that in a moment, if you like.
Thank you.
So these are just the headline stats that show you. So between all our social media platforms, Twitter, Facebook, Instagram, we have 90,000 people looking at those channels. So an extraordinarily large audience that we've spent a lot of time building through our engagement, and you can see the breakdown of the figures there. We build this audience, and then we connect with them informally every day. So with social media, it's not the kind of thing where you can just wait to respond. You have to be instantly interacting. So last week, or the last couple of weeks, when we had all of the really challenging communications about Tier 3, and there were lots of questions from the members of the public about what it meant to go into Tier 3, or what the possible, or even what it was going to mean before we'd even had confirmation of the restrictions. We were having to keep a dialogue going with members of the public. The moment we stop having that dialogue, that makes it really challenging for us to maintain our audiences. So it's a real challenge being able to reach people and meaningfully engage with people, but also make sure you're on the right side of policy and procedure in order to communicate with them effectively. So just some examples here of some of the communications that we put out on our social media sites, and the way that some people were engaging with that content. We try to answer as many conversations as possible, as many questions as possible, and often even just acknowledging it and recognizing that someone's been in touch can be enough. It's not always necessary to have exactly the answer that you need at your fingertips. And often recently, we haven't had the answers to all the questions that we've had. So we've had to take that view and point people to the government websites, tell them that the information's on its way, telling them that we don't have access to things at the moment that we'd like to have access to. And that's been okay. And actually that's played out quite well, because we've managed to build our audience despite that. And so it's a channel that has much greater potential in terms of day-to-day communications than more traditional mediums do. These were the examples of how we broke down the frequently asked questions that we had to prepare for when we were thinking about Tier 3. So we did a lot of work trying to make sure that we prepared our website to make sure that it had all the relevant information, so that when people went on it on Friday, they could access the information they needed. And of course, everything changed again, didn't it? So we had to be ready to adapt. These figures here, they just show the reach of our website. So 33,000 hits on the coronavirus pages of our website, which was quite extraordinary. Overall, page views, 1.3 million over the last 28 days. Of course, a lot of that would have been generated by what you might describe as the media frenzy. when we decided, when Nottinghamshire was certainly in the spotlight nationally very recently. I'm pleased to say that things have calmed down a little bit now. We've entered into a new phase. So just in summary, and I'll stop sharing the screen just for a moment, and I'll just show you some examples of other content that's been engaging. Bear with me a moment. So this, can you see this?
Yeah.
This is the actual live Facebook page. So this is where we're displaying all the latest information for our members of the public, where they can engage. We're also advertising for one of our job vacancies here. So there is business as usual going on our website alongside all the COVID stuff. We recognise that we are an authority that delivers services all the time, and just to give a sense of balance, it's got the full spectrum of services available. So we use this every day, and it's a channel that is incredibly popular. We take it very seriously as a team, and there's a lot of professional pride that goes into maintaining it. I'm very, I'd like to pay tribute to my team for all the work that they've done, particularly during the recent times. Our media team, our digital development officers, our communications and marketing officers have worked really well alongside our public health colleagues and Jonathan Gribbin, and it's been an enormous sense of pride for us to be able to connect with our audiences the way that we have as an organisation. But I think the potential next, and I think the next priority, is to build on bringing those human interest stories to life through examples of some of those the amazing work our care workers are doing, but also to look into, as a follow-up from the last Health and Wellbeing Board, to look into some of the behavioural science that sits behind people's behaviour, to see how we can be a bit more targeted and nudge people a bit more to amend and adjust their behaviour, because we are conscious as well that a lot of the time we are broadcasting messages to the public. Social media is an example of where we can interact with them, and that's shown that it's been worthwhile. So I'd like to explore that further, and Dr. Jeremy Griffiths and I had an email exchange that resulted in a conversation with a behavioural science provider, and I just got a bit of a window into the world of targeted behavioural science, which I'm going to explore a little bit further, and maybe able to bring back to this Health and Wellbeing Board in the future.
Thank you, Luke.
Thank you.
I think the message that we do put out never been so important that we get the right messages out now. Anybody with any questions or any ideas, any input to Luke, any suggestions? Councillor Joyce.
Yeah, I'm trying to work through what you've told me, Luke, because I'm not very good with IT. And when you said it was on Facebook, now I have seen things on Facebook where you can join a group. So is that what we have? Because I mean, I know all about the website, and I direct people to the website if they want information. But I like the instant thing of the Facebook with that like ongoing dialogue about what is happening, given how quickly things do change. So how do I find it? How do I find it on Facebook? I'm sorry to do like a one-to-one IT session
That's
here.
all right. No, should I just give you a hotline to ring after this meeting, and maybe it could be, maybe you and I need a separate conversation. But basically, I can talk you through that separately outside of this forum, if that helps you, Councillor.
And the reason that I'm asking that is because there's a newsletter that goes out in the area that I represent, all in Mansfield Woodhouse, and it goes into 8,000 homes and it's free. And I'm trying to put an information article together that gives people not only the website, but Facebook, because there's more older people on Facebook these days than even on just normal websites. So that's why, obviously, I would like to know how to do it, but that's why I think you need it. And before Friday is preferable.
No Thank you, Joyce. I think Luke will sort you out with that. Thank you, Luke. Yeah. Jeremy.
Yeah. Oops. Thank you, Luke. Very, very interesting, very encouraging, and it is I think there has been real visibility from the county council's communications around the current difficulties. Mine's a slightly different tangent, really. I'll just be interested in your initial thoughts. One of the things that's, I hope, that is going to get us out of this the situation that we find our overall health and well-being system in is the potential vaccine, which I hope, my understanding is that a lot of the late development research will be published, we hope, pre-Christmas. And certainly there's stuff in the national media about preparation being at a fairly advanced stage for a rollout of the vaccine. And it's in the public domain that the more vulnerable members of the community, as well as our frontline staff, would be some of the first people to be targeted, and then moving down towards the least vulnerable of our population. Now, the vaccine won't be a single solution to the problem, but it will make a significant difference to enabling our societies to return potentially as close to as they were prior to the epidemic. I'm just curious as to know whether there are conversations that are going on about across the system how the message about vaccination, which we've all obviously from a public health perspective have always supported, how the communications channels through health and social care, where there are conversations going on about how we're going to actually maximize the usage of our communications strategies in different parts of the system to tell the stories and to allay some of the fears of the community about potential vaccination. Now, Jonathan, I see Jonathan's coming up, so that's good. I saw an interesting message that was posted through a contact of mine, who's a researcher at Imperial College. He's a Nottingham graduate working as an Imperial College, and he's been contacted by WHO and is one of 9 researchers across the world, so in places like South Africa and India, where they're going to be using different channels of social media to send messages out to educate the population about vaccines, and to try and allay some of the fears, because some of the statistics that he talks about is that if we're really going to get significant protection for the community, we're going to be needing upwards of 65% of the population to be vaccinated. But the numbers that they're talking about are potentially that maybe only 45% of the population may actually uptake the vaccine. So it's a one on the horizon, really, but I would just be curious to know whether there are conversations that maybe are starting about making sure that we're getting innovative and consolidated messages out there to the population.
So the focus for us has been all along, it's communicating the key messages from the government. So because the focus, the line we've taken with our communication strategy is that we've tried to align as far as possible with the communications strategy from the government. So in relation to the public health messaging and making sure we're trying to affect people's behaviour, but also trying to reach out to them and protect them with the services and tell them how to access services. So no, in short, it hasn't been part of our initial conversations, but I'm sure Jonathan will probably have some views about how we can start moving the narrative more towards preparing our communications for a narrative around the vaccine in the future.
Would you like to come in, Jonathan?
Really briefly, thank you. So I think Jeremy is right to make sure that we don't think of a vaccine as some sort of silver bullet, but I think it will be or it has the potential to be a really important part of enabling us to live with coronavirus and to live with it more safely. The work around coronavirus vaccine and its rollout and everything around that is being led by our NHS. So there will be NHS national resources behind the kind of communications campaign. And I think that's what Luke was referring to. We're pleased from as local authority colleagues to be linked in locally with some of those early discussions, and we'll certainly want to play our part in helping to amplify some of those messages once they're set out for us. And I'm sure that organisations represented by all of the board members will have a role to play in that in due course. In the meantime, back to the much more immediate, there's a real need to make sure that we make the most of the flu vaccine and the potential that has for keeping people safe even in the next few months. I'm really pleased to say that we've been able to invest heavily in amplifying some of those messages. I know that NHS colleagues have been working really hard and that there is an improved uptake this year already around that. And I think we particularly need to be looking to some of the groups who typically are perhaps underserved by some of these interventions to make sure that we reach them too. That was all I wanted to add at this point.
Thank you, Jonathan.
Chair. Thank you.
Thank you, Jonathan. Sarah.
Yeah, just an early call, I think, to ensure that any communication, and I know that we've worked very well across working in partnership to get messages out. But I think one of the things we talk about, Jeremy brought up the vaccine, but Jonathan rightly brings up the issue of flu vaccine. But I think in terms of vulnerable groups, I'd really would like to urge that we put the deaf community as one of those priority groups to receive vaccine. I don't think it's been seen as one of those priority groups and the most vulnerable. But when we look at the deaf community, those particularly who are BSL users are not able to wear face masks very readily. So by the fact that we're talking about how we can protect each other, this is a community that is already excluded from one of the first line of defence that we have. So I know at Healthwatch we're very much in touch with the deaf community, and I'd like to sort of raise that as an early warning, really, that we must ensure that they're involved in how we communicate. Many of the usual channels are not always open to people who are particularly BSL users. So I just want to make that point here and to ensure that we can work through our partnerships to get all the key messages out there. And I would like to hear from Luke just what we have done already to support that community. I know there's a lot of confusion still, and it's not just about the deaf community, but also some of those much more vulnerable groups that are much harder to reach. So that's just my key point, to try and raise that as a point of awareness when we're thinking about planning, but also to have a bit of an update on how we're ensuring that we're communicating in all forms of communication to people.
No one to miss. Thank you, Sarah. Luke.
Thank you.
Thank you, Sarah, for that question. Yeah, it's prompted me to update you about the website accessibility program we've got going on at the moment. So there's a national move to make sure all public sector websites are accessible to everyone. And so we're prioritising that at the moment. And there's a colleague of mine who's working very hard on a project to bring our website in line with all the relevant standards nationally. But we're doing it, we're going above and beyond what's asked of us, and we're taking our time to get it right. And so I'll be very happy to give you an update outside of this meeting, or bring an update to this forum about how that's going and what it's doing to reach those groups that need to access information, no matter what their ability.
Thank you.
Thank you, Luke. Thank you, Sarah. Anyone got any further questions or any ideas, or any input for Luke to run with? No, thank you very much indeed. I mean, the recommendations were to identify actions to sort of help Luke out to point him in the right direction. Any input would be great for the receive. So thank you, Luke. You can I think you're going on childminding duties now. You've got to collect the kids from school.
Got to collect the boy from school, so I'll give my apologies.
Thank you.
Health and Wellbeing Board.
Thank you very much indeed. Thank you, Luke.
Bye.
Agenda item 7, which is Joint Strategic Needs Assessment Work Programme. Lucy Hawkin, Public Health and Commissioning Manager at Nottinghamshire County Council, will provide an overview of this item. This will include a summary of the process used to develop and prioritise the work programme for the Joint Strategic Needs Assessment. In line with the recommendations of the report, we'll be asked to approve the JSNA work programme. So can I call upon Lucy?
That's great. Thank you very much, Chair. So yeah, as you've outlined, the purpose of the paper is to seek Health and Wellbeing Board approval of our future JSNA work programme. So in order to develop our 2020 to 21 work programme, it was agreed that we would trial an annual prioritisation, and that would be overseen by our JSNA steering group. And really that was in hope to secure a more clear and timely steer from partners about topics of joint interest and strategic importance. So back in December 2019, Health and Wellbeing Board and partners were invited to propose JSNA topics that reflected emerging issues of joint interest and strategic importance. So as a result of that, we got 8 submissions through. We assessed those using our prioritisation matrix, which was shared with the board in a previous paper. And from that, really, we concluded that full JSNA chapters as they currently exist were not the most appropriate product for all those 8 topics. And that's really to, in order so we can achieve maximum effectiveness, we need to ensure that JSNA chapters aren't replicating work that's already happening within the system, and that our resources are allocated to producing JSNA chapters which will have the greatest impact. So, for example, directly informing a commissioning review. So we therefore, in the JSNA steering group, discussed what products could be developed where a full JSNA chapter maybe wasn't the most appropriate product at the current time, but where we agreed that greater insight and understanding into that topic area would be beneficial. Yes. So from this, the steering group proposes that we produce different products depending on the required need. Our initial work programme was due to be presented at the May Health and Wellbeing Board, but obviously as the meetings were temporarily suspended, we reviewed this work programme back in September in light of the changes resulting from the ongoing COVID-19 situation. And from that, we quickly realised that some priorities had now changed since we did that initial process in March, and it simply would just not be feasible to deliver the work programme as we had planned back in March. So we have proposed the outlined work programme, which hopefully within the paper you can see as a table of 4 topics, 2 of those being full JSNA chapters and 2 what we're calling the insight theme pages. The full chapters are children and young people who are looked after and care leavers and carers, and then 2 insight theme pages, which are speech, language and communication needs in children and young people, and air quality. So both of these products, the chapters and the insight theme pages, are things that we currently produce. There are some examples in the appendix, but you can also see them on Nottinghamshire Insight website. For the speech and language and communication needs submission, we agreed that actually first it would be helpful to collate all the existing resources we have, an insight that's already out there from across the system, into what we call the insight theme page, and determine what work was already underway from this, and then determine at that point if a further JSNA type project could be developed. Exactly what this may look like will be decided later down the line once we've collated those and reviewed the position. And then just finally, an important point we want to make with this paper is that obviously whilst every effort will be made to begin work on these topics as soon as possible, completion of all JSNA work has been on hold and still remains heavily dependent on the COVID-19 situation. Ongoing changes will inevitably impact the ability for us to deliver this work programme as planned, and that's largely due to the fact JSNA requires engagement from so many partners, and at the moment all of the different partners are having to constantly reprioritise work and resources, so it may be a while before work starts on these topics, and they're underway, but we wanted to importantly bring them to board for approval. So that takes me just onto the recommendation that board members approve this current proposed work programme. Thank you.
Councillor Shaw.
Thank you very much for the paper. I've just got a couple of points. One is like a hot topic for everything that we're doing at the moment, where it's all COVID related or whatever. Part of the work we're doing with, and we've heard earlier about the Bassetlaw Doncaster Trust, we're trying to work extremely hard to keep mainstream services and well, links to Health and Wellbeing Board, some of this work to keep going. I absolutely understand that COVID is taking people away from their day jobs and whatever and diverting them to other work. It's just that I am so pleased to see the children and young people looked after and care leavers. The carers, the question was, does that include young carers? But that you can answer that in a second, or whether it's because it said adult social care, so I don't know if that's just carers of adults. I'm just concerned that if we carry on with COVID for another year, say, and we don't get any of this work done with children and young people or any of the services, we're doing a massive disservice to children and to everyone really. So I know you'll know that, and Jonathan will be absolutely, well, I know the team will be thinking about this and working on it. It's just that each time we all say, well, we don't know when that's going to happen, the time moves on and moves on. And I just want to refer in relation to this about the workshop we had in February about giving children the best start and the strategy about that. And just a question to you is, does that work go into, feed into this work? So that's another little question. But I was astounded in the work plan that we had the workshop in February, and in the work plan, I mean, I can wait to talk about this later, but we haven't even got a draft in the work plan for Wednesday, the 6th of January 2021. It says give children the best start in life draft. We're just going to a summary of the workshop. We haven't even got a draft strategy for January. Well, that's like a year. And I'm just, it's like, in one hand, I am aware that COVID is taking over everybody's work, but surely we can also be doing some of the day job. Anyway, that's
thank you. I think we all share your frustration, Susan. There, yeah. Lucy, would you like to come back on that, please? Or does Jonathan want to?
Well, let me make, if I could make some more general comments. So, Councillor Shaw, I think colleagues in public health, and not only in public health, would share some of the frustration. I know that within the team, there are colleagues who are really very eager to be progressing some of what in normal times we would regard as absolutely essential work. And you've identified a couple of bits. The work around joint strategic needs assessment is enormously important. It's a statutory duty, and it has enormous importance and will do over the next year or two, because by 2022, which is not so far off, the Health and Wellbeing Board we'll need to be publishing it and refreshing and renewing the joint health and wellbeing strategy, which runs out at that point. And of course, we can only do that on the back of doing some good needs assessment work. So I'm very aware of the priority which should be attached to all of this. Nevertheless, we are, after 8 or so months of being in the thick of COVID response, unable any longer to carry on spinning plates around keeping the day job going alongside working every hour during the working week and through the weekend and some beyond on the COVID response. So unfortunately, notwithstanding the enormous importance of what you highlight, I'm afraid the answer is no, we won't be able to. We will do our level best to bring back to the board as soon as we can work that is now, 9 or 10 months old, and your point is taken about that, but we will be relying on resources coming forward from across the whole system to make that possible. It won't be on the basis of resources that we're able to bring forward from public health, because we are totally consumed really with the COVID response. Thank you.
Thank you, Jonathan. Thank you for your honesty. Councillor Guilfoyle, Glenn.
Chairman, I recognise that, and I talked to Jonathan yesterday about that same issue, about the workload and the impact that's having on both him and the staff. And I'd like to just take the time to thank the staff and everybody for the work that they've been doing during these last 2 months, and think that we've got to be realistic now about what can be achieved, and also whether there is an opportunity in any way, shape or form to look at what additional resources can be brought to bear, because clearly what Jonathan is telling us there is that the staff are nearly 100% working on COVID, and that they've got very little space to do anything else. So, if we as a board wanting other things to sort of be done, and including this, partly this is a statutory responsibility to complete, then we've got to actually look at the additional resources that are needed to do that, not just to say, well, we're not very happy because it's not being done. I think we all realise that it's not being done. I think the fact is there anything else that we as a board or anyone else can do to supplement that? Because all councils are in the same position. All councils are struggling. I know from talking locally to directors there who are saying, I can't respond to you. I can't respond to you because I'm dealing with this. And we have to accept that and to a degree. But clearly, what I put out is there anything else that we can do to support those staff? Is there anything that we can do to gain additional resources? I know that there's money coming in again from government. There's the £8 per head that's coming in to assist. But clearly that is, I would presume, is going to be around dealing with additional, resources around the COVID issue, not around releasing the strain. And the other thing, as Jonathan pointed out to me, is the difficulty as well. If we have got, say, the resources to recruit additional staff, is actually getting those staff. And, so that's another issue that we've got is, and I'm sure Jonathan would be able to speak on that, is it's not, even if we've got the resources, are the people out there with the necessary skills that we need to be able to do the job that needs doing. I think it's a difficult time that we're in, and we've got to have a lot of patience, but make sure that we can at least meet some of the minimum guidelines.
Thank you, Glenn. Jonathan, do you want to respond to Glenn?
Well, thank you, Councillor Guilfoyle. We'd be pleased to look at any and every option for how we can resource some of these priorities. Just to reassure you, within the County Council, receive a lot of support from right across the different corporate teams. In discussion at the moment with Melanie, for example, about how other colleagues within adults may be able to take on some elements of what ordinarily we would regard very much as public health remit in order to assist us with some of this. You won't find us dragging our heels on any of that. We'll be pleased to attend to these priorities and to push them along just as soon as we can.
Thank you, Jonathan. Susan, would you like to come back?
Yes, I just want to say, Jonathan, there's absolutely no criticism to you or your team at all. You're doing a fantastic job, and we continue to respect everything that you're doing. As Councillor Guilfoyle said, as a district councillor, you know, the team at the district are doing all they can as well. So I absolutely get that. It's just that when it comes to children looked after or some of these absolute priorities, it's just a bit like Councillor Guilfoyle was saying, is there any way we can support, everybody can support you to support this work, because they're still out there, they're still living their lives as fostered young people and all the rest of it, and it's hugely important. So please don't think it was a criticism. It's just...
I think we're all trying to achieve the same thing, Susan. Sarah?
Yeah, I think it's... I want to echo what Councillor Shaw's just said to the public health team. I think everybody's working under enormous pressure at the moment, and we are all frustrated, I think, with the lack of space to do what was the original day job that we all are doing. And I think that's really, you know, worth us acknowledging that people are doing the best under incredible circumstances. I do wonder if there is a way to relieve some of that pressure by thinking again about how JSNA is created. And I do think there's some scope within, particularly say the carers JSNA work that's done, where you could work with the voluntary sector organisations that deliver most of the interventions for carers, to actually see what insight they can do. And obviously the difference in the products that Lucy has outlined to us may be that a full excuse me, JSNA might not be possible, but there could be some really helpful insight by talking to providers to actually help for them to help us understand what the interventions that are out there and the work that can be done. I know in the past we've tried to do a much more collaborative approach to JSNAs, and to have the insight of as many people as possible into those JSNAs. So I do think, you know, we all have to be really creative at the moment. We have to maybe not do what was usual, and do things differently. So that might be a way in which we could, as a Health and Wellbeing Board, look to see who else could be out there that could offer us some useful insights that would keep things current, at the same time as not obviously being able to do a full JSNA, but provide some really helpful information to this board, who will have those statutory duties to prepare the health and wellbeing strategy, and to be fully informed in that. So obviously it's about ideas, it's about people being able to help, but I think we should realise that we've got many assets in our system, and including the voluntary sector in that system, that might be able to support what you're trying to do, as well as colleagues from other parts of the local authority. So that's just a point I wanted to make.
Thank you, Sarah. I'm going to bring Colin Pettigrew in, who might be able to enlighten us a little bit more. Thank you, Colin.
So thank you, Chair, and Colin Pettigrew, Corporate Director for Children's Services with the County Council. As we enter this second wave, a couple of things I probably would be worth mentioning and reminding people is that one of the significant differences is that schools will be open during this wave, and I'm sure that probably divides opinion within this room and many other rooms as to whether that is the right or the wrong thing to do. The other thing to mention, however, is that there's been a directive from the Chief Nurse of Public Health England that Public Health England Children's Commission Services that during the first wave was stood down in order to support frailer, older people will not be stood down during any second wave, and that those public health commission services such as health visiting will continue to support, and therapies will continue to support vulnerable children during any second wave.
Thank you, Colin. Melanie Brooks.
Yep. Hi, thank you. So I was going to ask Colin to comment on the fact that we are still operating and working. So it isn't that services to younger people have gone away and to children. It's just that in terms of the department across adult social care and public health, we're having to prioritise what we focus on, and that is about response mode. And we are very public about this. So we made this very transparent. We have a paper going about our strategic priorities in the next 3 months to Adult Social Care Committee on Monday. And we've also made this public through Improvement and Change Committee about how we're prioritising our programme of work. And the top priority we have is about local outbreak of response. It's just to reiterate my earlier presentation that we have 45 outbreaks in care homes. Each one of those outbreaks has a health and social care incident team managing the outbreak. So that is people on the ground managing that work. So that is kind of the priority. It's about improving people's lives and well-beings immediately. I think we're very well aware that COVID has a disproportionate impact on people's health. We know it discriminates for people. We know it affects vulnerable communities more adversely, and we know there's a non-COVID harm risk that's increasing because of the measures we're living in. But unfortunately, we're in the position where we're having to prioritise our capacity, and we have already within the local authority redeployed within the department, within teams, and within the corporate centre on those activities. So it's not that we sort of got people sitting around available that we haven't already thought of to redeploy, and we are also we have been recruiting in public health capacity as well. So it's just to give that bit of assurance. We've taken this very seriously, and we're making it very public because of the risks that we're aware that are alongside that.
Thank you, Melanie. I think everyone on this board are well aware of all the fantastic works being achieved by both yourself and Colin on the children's side. So keep up the good work, and I think we all share the frustrations of everyone, and we're all looking to achieve the same outlook. Any further questions, Jeremy?
Yeah, thank you for that. I completely understand, Jonathan, the situation. We are in unique times. I guess it's I was just looking at the health and well-being strategy around the legal obligations that we have, and I guess we're fortunate in many ways that our strategy doesn't need renewing until 2022. And some of the legal obligations around reduction of inequalities remain principles within the whole system. I guess my concern would be if we were in a similar sort of situation in 2021. So if we took the situation 12 months further forwards and we were in a similar sort of position, where our sort of risk assessment would be in terms of us being able to produce not only the JSNA but also a strategy that actually shows progress towards things like reducing inequalities. And so I guess I understand the feedback now, but I guess going forwards, in an ideal situation, it would be good to know what would be the things that would enable activity from a JSNA perspective and the development of a up-to-date strategy to be enabled.
Thank you, Jeremy. I think moving forward, I think the goalposts are continuously moving. So we are actually being asked today to approve the work programme, and no doubt that work programme will change in the future. If anybody got any more input into the work programme, otherwise we need to have a proposer and a seconder that we accept the work programme as it is at the moment to move forward. Can I have a proposer, please? I'll propose. Have a seconder. Yeah, have a seconder.
I'll second it.
Thank you, Susan.
I'll second
Thank you, thank you very much indeed, and thank you all for your input in that.
Could I just looking at the programme, at the moment it only goes up to January 2021. Can I ask when we might?
Lucy, do you want to reply to that?
I just wonder when we might understand what the ideas are around the 2021 agenda.
Sorry to jump in there. Nick, I don't know if Nick's still around. He's covering the Health and Wellbeing Board.
Could I clarify, are we talking now about the Health and Wellbeing Board programme, Jeremy, or are you still talking about the JSNA work programme more specifically? Could I just check?
Oh, sorry, I'm a bit ahead of myself. Sorry.
It's all right. Okay.
That's right. Thank you, Jeremy. Did we have Amanda wanting to speak?
Yes, Chair, I was just going to say the same thing again. Although Jeremy's point is valid, this is our JSNA work programme for 2021.
Right.
But we will, as has been mentioned, look at where we are capacity-wise to renew and do a topic identification and prioritisation process again in the early springtime. So then we'll be developing next year's JSNA work programme to continue.
Thank you, Amanda. Are we anyone against the work programme or any abstentions, please? If not, I'll take it we're all in favour. Jeremy, we're now moving on to the work programme. So I'd like to draw your attention to the work programme. The next time we meet is Wednesday, the 2nd of December, and it'll be our first workshop since the pandemic. As with current meetings, it will take place virtually. The subject will be the recent review of the Better Care Fund, agreeing the vision and principles to guide our integrated approaches to health care and housing in Nottinghamshire. Our next meeting will be Wednesday, the 6th of January. As mentioned, our previous meeting, COVID-19 continues to demand significant resources and respective organisations. We therefore need to strike the right balance before carrying on the work of the board, whilst affecting the ability of colleagues to maintain their response to COVID-19, and we've seen the pressure on that. So would members like to comment on the work programme? Any comments on the work programme? Jeremy, sorry, are your hand still up, Jeremy? Are you...
Sorry, I've not lowered it, but I would like to say something.
Certainly.
I would like us to, at some point, focus on the inequalities aspect from the Health and Wellbeing Board, whether that's in some sort of workshop. It always strikes me that inequalities is seen as a key part of all programs, but never gets focused on as a topic in itself. And I think it's particularly relevant. I do notice that there is there was some work that I think was being planned out from Bassett Law around inequalities. Yes. But I think it would be good to look at the whole of Nottinghamshire and look at the latest data and some of the information that's going to be used from a health perspective about population health, and particularly the impact of the epidemic on widening inequalities. So I think I would just as a given that it's one of our key goals is to reduce inequalities from the Health and Wellbeing Board, I would just urge us to, if we could bring that as a topic by itself and actually look at some of the measurements and how we actually go about doing some of the reductions. I think that would be worthwhile exercise.
Yeah, I agree with you, Jeremy. I agree. I'll bring in Susan, and then we'll ask Jonathan to come in. Susan.
Yeah, hello. Probably Colin. Well, we can answer this because I did refer to it before. When we meet, when we have the summary of the workshop that we had on the 5th of February 2020, that's in January 2021. Are we actually just getting feedback from our workshop, or will there be a draft strategy that we're looking at? I was just interested in that because it's I know we've just, notwithstanding what we've just been saying, but that will be a year since that was done. And then just one more point is the return of children to school and associated health and wellbeing issues, which is going to be talked about in July 2021. And it said it was requested in July 2020. So that will be a year as well. I mean, maybe that's standard.
I know, I can see where you're coming from. Thank you, Susan. Colin, would you like to come in and answer Susan's question?
Yes, I will do. Thank you, Chair. And Susan, what we could do for January is to identify what progress, if any, we've made on since the workshop in those areas. It will be limited, because the workshop was, as you say, in February. Schools closed on the 20th of March, and only reopened for all pupils again in September of this year. So that's a significant concern. And with regards to inequalities, what we do know is that those children who already were suffering inequality, were probably the gap for them is likely to have widened and will widen over the next few years. So we can bring something more substantive, I think, to the January meeting. Chair.
Thank you, Colin. Thank you, Jonathan.
Yeah, thank you. And the point around inequalities, I think, is well made. I think that's something that would be partially addressed, at least, if we're in a position to bring forward the report from NHS colleagues, which I know that they were keen to do some work on in terms of looking at indirect impacts on health outcomes and access to health care. And that was going to be something not just for Bassetlaw, but right across the whole of Nottinghamshire. Now, I know that as far back as the summer, I do know that David Ainsworth and one of Idris's colleagues were looking at that. I think it's probably worth a discussion offline just to check how they're positioned now to bring that forward, because of course I'm very aware that they too may be under some heightened and increased pressure now as well, dealing with wave 2 themselves. But perhaps we can come back and confirm that with board members as soon as we can about when they could do that.
Thank you, Jonathan. And thank you everyone for your input today, and thank you all for attending, and thank you all the officers for all the work they're doing. They're doing a fantastic job. So our thoughts go out to all of them. And Jonathan, you're doing a wonderful job keeping everyone informed. Fantastic. So I'm looking forward to see you all in December, and keep safe, all of you, and keep up the good work. Thank you very much indeed.
Thank you.
Thank you.
Thank you, Chair.